Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and someone living with my own chronic pain for over 30 years. Today I want to talk about a hot topic that a lot of people have a lot of sensitivity to, and that's the importance of recognizing coexisting problems when people are suffering or living with chronic pain. One of the main reasons for treatment failures with this population is the healthcare provider's inability to either identify or effectively manage coexisting problems that often go along with people living with chronic pain. A lot of people have criticized me for talking about addiction and chronic pain, for example, or psychological disorders and chronic pain. What I know from working with people for the past 29 years who are suffering with chronic pain and coexisting problems up to and including addiction, that if you don't identify these red flags, there will be a big problem. Now, while the percentages are fairly low, only about 10 to 15% of people who are on chronic opioid or benzodiazepine medication management having problems with their medication, the numbers are much higher. The Institute of Medicine estimates that there's over 116 million Americans living with chronic pain. Let's say at least 100 million of these people are on chronic medication management. That means that between 10 and 15 million people will be experiencing problems with their medication, from mild abuse to pseudo-addiction and even addictive disorders in some situations. So what's the solution? The solution is using an integrated pain management approach, which all the best practice principles from some of the leading pain management providers in the world suggest. Integrated chronic pain management using a multidisciplinary treatment team and with the patient being the captain of the team has had the best outcomes, in my opinion. The people I work with, I work as a coach and a guide, and I really encourage them to set up a team of professionals. To learn more, check out my Freedom from Suffering book, where there's a whole section on how to develop an integrated multidisciplinary team approach. Remember, freedom from suffering is everyone's right, but it's also their responsibility. And I believe as a healthcare provider, it's my responsibility to help people identify and recognize coexisting problems such as depression, anxiety, trauma, substance use disorders, abuse, dependency, addiction, or pseudo-addiction in order to help them have successful treatment outcomes. Thank you.